So, hi. Wait. Good afternoon, everyone. I'm Esti Shelly. I'm from the Ministry of Health. I'm leading the Digital Health Division in the ministry. And I'm here to tell you how we, as the ministry, we heard a lot of people talking today about the regulators and the regulation and how governments should approach big data. And I want to share with you how we in the Ministry of Health are looking at big data strategy and to share with you some, we are doing actually today, we are revealing the Timna platform today, the big data platform of Israel. So we heard today a lot about the big data uses in health, and when we are talking about big data in health, I'm talking about research based on clinical and administrative data. And of course, we heard a lot about the benefits of increase the efficiency and improve the patient journey, improving the care and promoting the knowledge in health in total. So here in Israel, we have the unique opportunity. We heard today about some of the strengths. One of them is the information. We have 20 years of digital information. We have integrated and shared digital EMR with OFEC system, and currently we have a TAN that's going and running in 5 hospitals already. This is the information exchange network of clinical information. We have very advanced health system, only 4 HMOs, hospitals across the board, all full coverage by the HMOs in Israel. We have the DNA of Startup Nation. We are leading in R&D, both in technology, cyber, and in medicine. And here we see the innovation and the combination with which Eyal spoke earlier. And we have the benefit of a 5-year program that was a result in a cabinet resolution a year ago of digital health as a growth engine that bring 1 billion Israeli shekels to support digital health in Israel. But working on big data raised big questions for us as a ministry. I will give some of them. I'm not going to give the solutions and not giving the answers, because this is those are questions which I think this is like going in a milestone field. So who owns the data? Who owns the data, the patients or the organizations that are holding the data? Where the data sits and how we promote collaboration and cooperation between the stakeholders. Is it in the government, in the healthcare, in the industry? Where the data sits, it's a huge question when we are talking about data sharing. And everyone talks today about the benefits of doing research in big data when we are able to do data sharing. The implementation, are we talking about research just for the research itself, or we are talking about clinical research for implementation, something that is very practical? Do we separate those like fields, or we are trying to do some hybrid model for that? And what is the regulation need to do in big data? Do we need to have a regulation at all? Do we as a ministry need to regulate this field, and it should be like strict or very centralized, or none at all, and let's give the market forces to do their own? So in Israel, the Ministry of Health choose a multifaceted approach. We will talk today about the policy, the incentives that we are giving specifically in the field of big data, and the infrastructure. So in the policy aspect, we are talking about balancing, again, the advance of and transformation in healthcare and to protect the interest of the citizens of Israel. This is our responsibility as a government. So we are talking about 3 cycles of protection on secondary use of clinical data, where big data research fall under those fields. We're talking about technical circle, technical protection, data identification, secure environment, users control. We're talking about procedural protection. This is IRB committees, transparency, and other organizational policies, and normative protection, saying that each citizen in Israel has the ability or the right to opt out, to opt out from that his personal information won't be used for clinical research, even if it's de-identified. And data use agreement between the institutes and the industry. And we are not stopping there because, you know, usually ministries are writing regulation and publish laws, and that's it. We believe that we need to do much more in order to make it happen. So one of the things is to make a federated IRB IT system that enables and promote, make it faster and make it fully digital, the IRB approval process. The opt-out mechanism. I don't want the citizens of Israel need to do opt-out in Clalit and then to do opt-out in Sheba and then to send something in a fax to make sure that all the organizations understand that they don't want anyone to use their data for research. So we are developing, and this is something actually that is going to be ready really soon, opt-out portal in the Ministry of Health. The incentives. We understand that the health organizations in Israel, their focus is in giving care. And if we want to see more organizations in this playground, we need to give incentives to make sure that to encourage the health organization to develop their own plan to improve the access to clinical data for research. So we publish a final incentive, incentive program that each organization, Sheba, for example, applied one, that can support the infrastructure and also to hire people just in order to see how they improve, because Sheba is in a different place from Poria, for example, or Sheba and Clalit in total different needs. So each one of them developed a plan, 2 years plan, and we in total got 26 organizations that applied, and we give them support in 32 million Israeli shekels. That happened just in last December. The pilot program, it's a joint government program of the Israel Innovation Authority and the Ministry of Health, and the funds actually come from Digital Israel. It's a biannual call for application. Ami Applebaum this morning talked about it a little bit, those of you who heard. The idea is that the technology companies submit a request for funding, and the health organization are kind of a subcontractor of this program. And the government gives 20 to 50% funding for the pilot. And in the first round, we had 52 applications, which is kind of amazing in such a small country. 22 health organizations applied. We want to see 50 health organizations in the future, but 22 health organizations for the first round of the pilot, it's amazing. 24 pilots approved, public funding of 35 million Israeli shekels. And 15 health organizations were approved in those 24 pilots. It's really changed the balance, and this is what we hear from the health organizations. It really changed the balance between the industry and the health organizations. About the infrastructure. So Timna. Timna is a national platform for big data health research. Timna in Hebrew is תשתית מחקר נתוני עתק. And here we can see Timna Park in south of Israel, and it's a nice meaning also thinking about data mining in that aspect. And we have here the project leader, Dror, say hi. Dror Ben Moshe is the project leader, and he actually is the one that should stand here. He's the project leader of Timna, and he developed it in the last 2 years. It's a new program, a new platform, and I want to share with you some of the agenda, the strategy. We just finished in the last weeks a new strategy for Timna. When we started 2 years ago, we set a set of goals of what we want Timna to be. And in the last weeks, we sat back and reviewed the strategy and thinking 3 years ahead where we want to be. So I want to share with you, this is the first time, actually, we didn't present it yet to our Director General, but we are sharing it here. And what we decided is that the goals of Timna is to be the one-stop shop. We want to have advanced, secure, regulation compliant, not capable, but compliant, research environment for the Israeli healthcare system with multiple data sources. We want it to be affordable and customizable for the health organizations. When we are thinking ahead, we are thinking that in 3 years, we want to triple the number of studies and the number of organizations that are taking part in this platform. And we want to make sure that we have a sustainable research environment. Until today, the Ministry of Health and the government of Israel funded this infrastructure. I won't say numbers, but this is a lot of millions of Israeli shekels. And when we are looking ahead in the future, we know it needs to be sustainable, and it means that it should cover the cost of its infrastructure. So when we're looking at how it works, we have the Israeli healthcare system. You can see the different organizations to the left. We have the main reservoir. When we, in the entry point, we are doing the de-identification. Then we have the reservoir where we have the de-identified and the secure data. And then we have the research environments, research rooms, which are currently not yet on the cloud, but this is something that is going to be in the near future. We are using currently a set of different technology tools, IBM Watson for the NLP, image processing tools that we are currently reviewing, and of course any other options. We also have all kinds of bring your own license if you're working with different kind of technology systems. And after we will go and move to the cloud, to Amazon Web Services, it's of course going to be much more easier to bring new technologies in. The idea of Timna is to have end-to-end solution, which will be available for health organizations, where we can have data scientists, epidemiologists, the identification services, storage, NLP, image processing, all in one place. We have a joint effort, a full support of the ministry on the regulatory aspects, on the policy. And one of the things that we don't have a solution yet, and it was very interesting to hear what you have in Mount Sinai, is how we, now it's a research environment, what we do in the operative environment, when we have already the algorithm, and how we do the deployment, and how we make it operational for future use. So I want to share with you 2 use cases that are already been completed in Timna. One of them is research that was done with Leumit, Dr. Marzon and Dr. Rosenberg from Leumit. The idea was to develop a pregnancy tracking. We know that it's pregnancy in general, it's a huge issue of medical legal suits, and the idea is to see how we improve the physician adherence to the MOH pregnancy protocol. So we want to know in real time or near real time whether the physician followed the protocol or not. So the solution was developing a clinical notes analysis using NLP and the codes, and currently we are, Leumit are considering of how to implement it in the HMO in total. The second use case is the Smart ICD. Smart ICD was developed with Dr. Oad Hochman, who is the Deputy CEO of Hillel Yafe Medical Center. And the idea is to how we improve the documentation of the EMR. We know that the physician or the surgeon in that case can write in the summary that he done, I don't know, knee surgery, and the code that he chose, the ICD code, can be something that is not related to what he really does. So the idea is to read the operation summary and to make and to provide the support using NLP to see what is the right ICD code. And it was developed in Hillel Yafe, and now it's tested and checked in Asaf HaRofeh, and we are looking in other hospitals and other clinical fields how we can broaden this research. So currently we have over 10 health organizations that are already working with us in Timna, over 20 research projects in different phases, and as I said, in 3 years we want to triple those numbers. And just before we finish, I want to go back and to remind us for what we are doing it. When we started and looked on the strategy, we thought, okay, we can have a beautiful research environment, but we want to make sure that this research environment, in the end of the day, is supposed to bring bring better healthcare in Israel for the citizens of Israel. That's it. Thank you.